Okay folks, today I want to talk about HSV 1 and 2. Herpes simplex. It scares almost every college student. In fact, I might say everybody is scared of herpes because it causes those blisters, and those blisters, they ache and they rupture, and they cause that fluid to go around. They cause that stabbing pain. So almost everybody hates herpes. The word itself carries a lot of stigma. So I want to give you some important points about this disease. Herpes simplex virus infections, they occur equally between the sexes, both males and females. They get it equally. And also it occurs throughout the year. There is no seasonal variation in this disease. And the transmission can occur from the oral to oral, oral to genital, or genital to genital contact. HSV2 lesions largely involve the genital tract because the virus remains in the sacral nerve ganglion. From this nerve ganglion, this virus comes out and wreaks havoc. And the symptoms and signs, both viral subtypes can cause genital and oral lesions. Okay, so HSV1, even though it affects the mouth mostly, it can cause genital lesions. HSV2, even though predominantly it affects genital regions, it can also cause oral lesions. So most people get genital and oral facial infections. These infections caused by two subtypes are clinically indistinguishable. So you cannot say whether this is coming from type 1 or type 2 just by looking at the lesions. And gingivostomatitis and pharyngitis, those are the most frequent clinical manifestations of primary HSV1 infection. And it presents as a small grouped vesicles on an erythematous base. That is the keyword. Whenever you see small grouped vesicles, think of herpes. It causes burning sensation and stinging sensation. It leaves a swollen and tender, burning, tingling feeling. And it can cause genital infections. In genital infections, most of those infections are caused by HSV2, and it presents with bilateral genital ulcerations and tender lymphadenopathy. It can also cause ocular eye disease, HSV keratitis. It presents with vision loss, pain, and discharge. In fact, it is a major cause of blindness from corneal scarring and opacity. Then another point is neonatal or congenital infection. One of the most horrible manifestations of this disease is in babies. The neonatal HSV can present as excessive tearing, eye pain, conjunctival edema, vesicular lesions of the mouth, palate, tongue, and these babies can have seizures, irritability, fever, multiple organ failure, and even death. So it's scary, folks. Herpes can cause death in these babies. And then CNS disease. Both viruses can cause encephalitis. The temporal lobe is often involved. It presents with rapid onset of fever, headache, seizures, focal neurological signs, and impaired consciousness. It can also affect the facial nerve, causing Bell's palsy. Then epiglottitis. This herpes virus can go into the esophagus, and it can cause vaginoephagia, painful swallowing, fever, retrosternal chest pain. So when a patient says retrosternal chest pain, especially HIV patients, always think about herpes. Then erythema multiforme. HSV infection is the most common cause of erythema multiforme. Cutaneous eruptions occur 2 to 7 days after herpes simplex infection. Now, diagnosis. Personally, I just go by clinical manifestation, that's all. You look at it, you see the vesicles with the erythematous base, that is herpes. But you can also do labs like direct fluorescence, antibodies, slide tests, viral culture, polymerase chain reaction. And the treatment, you start within 72 hours, you need to start antiviral treatment, acyclovir, famciclovir, valacyclovir. And severe or frequent recurrences, chronic suppressive therapy with antivirals, keratitis. Like remember, when these patients have herpes in their eyes, do not use corticosteroids because corticosteroids will only exacerbate this infection. Now, prevention, male circumcision is associated with a lower incidence of acquiring HSV2 infection. So, good old circumcision is good to prevent herpes simplex 2 infection. So, recommend circumcision in people, in men who are at high risk for herpes. So, those are the most important points about herpes. If you are suffering with this problem, if you want to talk to me about the treatment, please visit me or call me. My phone number 814-424-2095. Thank you so much. Have a